the biochemistry and biophysiology of the alternative and complementary medicine. And in particularly, we are going to talk about the effects in PTSD or post-traumatic stress disorders. Post-traumatic stress disorder is as a result of the trauma that has happened in past, and these are lingering effects. And the alternative and complementary medicine is alternative to the modern medicine, and complementary medicine is complementing that effect. And we know that there is a limited treatment available in the modern medicine for the treatment of the post-traumatic stress disorder. I am Rajeev Gupta. I'm a consultant in the United Kingdom. I have been trained in the Western medicine or modern medicine throughout my life and have almost more than 30 years of experience. But also for past 10 years, I have been working on filling the gaps in the modern medicine with the alternative and complementary medicine so that the patient can have the maximum benefit. And our focus is on evidence-based integration with the conventional treatment to improve the outcomes, particularly for the trauma survivors in this case, using the biochemistry and biophysiological model that confirms the benefit. And now, when we try to define the clinical overview of the uh, post-traumatic stress disorder, it is a neurological condition and affects almost 7% of the US population during the lifetime. And the situation is very much similar in most other countries, particularly the developing countries. And the patients experience a traumatic re-experiencing the persistence, avoidance, and chronic hyperarousal of the experience that they had. And it is quite stressful and difficult for the people. This has happened to people who have been affected in war or in severe injuries, but it still happens to the people who have been exposed to severe stress or trauma. It could be emotional trauma, domestic violence, or sexual abuse, physical abuse, or even the severe accidents that happen, or people have witnessed the experience and that trauma actually imprints into their brain. So PTSD typically develops following a trauma, combat exposure, abuse, or surviving disasters, but the modern mechanisms are much subtle and minor, but the effect is still major because the newer generation is more susceptible and their ability to cope is relatively less. And I'm not saying for the sake of it to blame the younger generation, but there is so much change in the environment and reduction in the social, emotional, and family support, as well as the distraction of the social media and more reliance on the internet, which can give a mixed material rather than filtered emotional support to people. Let's talk of the conventional treatment for PTSD. And this is primarily the psychotherapy approach. And the evidence-based treatment includes CBT or cognitive-based therapy or cognitive behavioral therapy. Sometimes eye movement desensitization is used and the reprocessing is used. However, in the national health system, I have found the use of the latter two much, much less common. These approaches help the patients to process the traumatic memories and develop the coping skills in a positive way. When we talk of the drugs or medicines or pharmacological interventions, SSRI or selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors, SNRI, are the first line medications. These medications target the neurotransmitter systems implicated in the PTSD and the pathophysiology for it. Coming to the treatment challenges, we know that these drugs or medicines can have the side effects, and many patients experience the treatment resistance or partial response to the standard therapies. And the side effects can include sexual dysfunction, weight gain, and sleep disturbances, which can be quite worrisome and troublesome in some of the patients. Therefore, there are unmet needs in the PTSD treatment, and we can help personalize the gaps, which is very necessary for these patients who have been emotionally traumatized, and they need individualized approaches for the complex symptoms or complex array of symptoms which are very personal to each patient. And usually, because it is not personalized, but also there is drug use with side effects, there is incomplete response and high rate of partial or non-remission with the standard care. And the third problem is patient dissatisfaction with a growing demand for holistic and integrative options necessary. And a good 60-70% of patients use the alternative and complementary medicine for their treatment without even discussing with their family practitioners or general practitioners or allopathic or modern medicine practitioners. The time is now necessary to tackle this challenge, which create opportunity for complementary approaches that address the whole person, not just the isolated system or symptom. Complementary and alternative medicine, or CAM as it is usually called, is another system that is helping to support the modern medicine. And this is in form of integrative medicine where there is no competition of these, there is collaboration of the systems for better patient care. Complementary medicine or therapy is used alongside the conventional treatment to improve the outcomes, and these approaches supplement or aid or help the standard care protocols and is relatively more easily accepted. Alternative medicine, on the other hand, are practices used instead of the mainstream medical care due to the systems being parallel, and patients may choose these options when conventional treatment fail. What we are suggesting is integrative medicine, which is a thoughtful combination of the evidence-based conventional and complementary approaches, which represent ideal clinical model. When we think of classifying the complementary and alternative medicines according to the National Institute of Health, it includes the natural products, which are herbs and botanicals, dietary supplements, and probiotics. On the other hand, it also includes the mind-body medicine, which is meditation techniques, yoga practice, and guided imagery. Now, if we expand it further, it includes the manipulative practices such as massage therapy, spinal manipulation like chiropractic, and osteopathic techniques. And if we move horizontally to a more ancient system which has existed for thousands of years, traditional Chinese medicine in form of the acupuncture, tai chi, and qigong, ancient Indian medical system like Ayurveda and yoga, and naturopathy. So all these, if we combine, that makes the integrative medicine. So the use of complementary and alternative medicine in PTSD population is quite vast, particularly the combat veterans, where they have found the exposure to the war, which flashes back and affect quite seriously, sexual harassment, disaster survivors, childhood trauma, child abuse, and first responders to like big fire outbreaks or other serious crisis situations. So these people are quite vulnerable because they have been exposed to a significant trauma that prints into the brain and intermittently flashes so as to cause significant difficulties. Now, the rationale for evidence-based integration is primarily for the patient benefit. There is growing interest in the non-pharmacological options for managing the PTSD symptoms, and that's usually the patient choice. Second is also safety considerations, where many complementary and alternative medicine therapies now offer minimal side effects compared to the traditional conventional medications in the modern medicine or Western medicine. And third is symptom complexity, where PTSD manifest differently across different individuals, and that require a diverse treatment approach which can be individualized to each patient to address particular symptoms in a particular way so that that patient has reversal of what was exposed at initial trigger factor. There are also treatment gaps because conventional treatment alone leave many patients with residual symptoms and side effects. Therefore, complementary and alternative medicine can help to fill the gaps. Talking of the biochemistry of stress and PTSD, there are few key pathways. The first one is acute stress response, because hypothalamus release CRH or corticosteroid releasing hormone, triggering pituitary ACTH, or this is actually the hormone that is pre-cortisol, and ACTH secretion happen from the pituitary, and this cause adrenal cortisol production or cortisol production from the adrenal gland. The second is chronic stress adaptation. Repeated trauma leads to HPA axis or hypothalamic pituitary axis dysregulation and abnormal cortisol patterns, which is a significant contributor to the stress biochemistry or stress responses. Third is neuroinflammation. Elevated pro-inflammatory cytokines create neuronal damage and altered neural circuits, which causes significant problems due to neuroinflammation, and the symptoms are sometimes slow but vast and quite difficult to manage. The fourth mechanics is the neurotransmitter imbalance, particularly disruption in the serotonin, norepinephrine, and GABA, the gamma aminobutyric acid, which contribute to the PTSD symptoms. And hence, if we tackle these four mechanistic pathways in a way for slowing down the process or reversing the process or stabilizing the process, that could be quite helpful. When we think of biophysiology of PTSD, the systemic effects are quite vast. And if you think of the neuroanatomy, the neurological impact is quite significant because of the hippocampal volume reduction in chronic stress situation. And also there is amygdala hyperreactivity and inhibition of the prefrontal cortex, which is the executive function of the brain or executive part of the brain responsible for cognition, thinking, and memory. The second is immune dysfunction, and the system or pathways are elevated inflammatory markers, particularly neuroinflammation, increased interleukin 6 and TNF alpha, and compromised immune regulation. When we think of the cardiovascular effect, there is elevated resting cardiac rate, and that is well known in stress, your heart rate goes up. And also there is blood pressure going up or increased high blood pressure, and greater risk of the heart disease, which happens in many of these patients. Hence, the mechanic target for complementary and alternative medicine in PTSD is the stress hormone regulation, And complementary and alternative medical therapies can normalize the cortisol pattern and reduce the stress hormone fluctuations. Also, they cause autonomic rebalancing, and mind body practices like yoga, Ayurveda, or Qigong, or Reiki, or other energy therapies, they enhance the parasympathetic tone and counter the sympathetic dominance, which happens in the fight or flight response associated with PTSD. The third part is anti inflammatory action, and several complementary and alternative medicines, including ashwagandha, turmeric, and many other, reduce pro inflammatory cytokines that drive the neuroinflammation. And this is also observed in yoga, meditation, mindfulness, and Qigong. Neuropathic support is also there for complementary approaches, and this can increase the brain derived neurotrophic factor, supporting the neural repair. So, I have presented to you the scientific mechanics of how PTSD happens and how these factors can be stabilized or reversed through alternative and complementary medicine. Thank you.